Welcome today. We're turning our attention to a topic that impacts millions of individuals and families worldwide, dementia. But we're not just talking about the well-known symptoms. We're uncovering the silent signs that often go unnoticed until it's too late. So whether you're a caregiver, a healthcare professional, or someone simply curious about understanding the complexities of dementia, stay tuned as we explore the silent symptoms you need to watch out for. It's time to empower ourselves with knowledge and awareness. Let's dive in. Dementia is a progressive brain disorder that impairs cognitive functions, such as memory, thinking, reasoning, and the ability to perform everyday activities, often accompanied by changes in mood, behavior, and personality. It encompasses conditions like Alzheimer's disease, vascular dementia, Lewy body dementia, and frontotemporal dementia, each affecting the brain in different ways. An example of someone suffering from dementia is a woman named Margaret, who initially shows signs of several short-term memory loss, such as forgetting recent conversations and appointments. Over time, Margaret begins to struggle with complex tasks, like managing her finances and following recipes. She becomes increasingly withdrawn from social activities she once enjoyed and exhibits noticeable changes in her mood, alternating between irritability and apathy. Her ability to make sound judgments deteriorates, leading to poor decision-making, such as neglecting personal hygiene and getting lost in familiar places. As Margaret's condition progresses, her family seeks medical help, which confirms a diagnosis of Alzheimer's disease, highlighting the importance of early recognition and intervention in managing dementia. So here are 6 early signs of dementia. 1. Subtle short-term memory changes. Subtle short-term memory changes are often one of the earliest signs of dementia, even as long-term memory remains relatively intact. Individuals might begin to forget recent events, such as a conversation from earlier in the day or an appointment made just hours ago. This decline can manifest in repeating the same questions within short time spans, as the person cannot recall having already asked. Forgetting important dates or losing track of tasks that were just discussed can also be indicators. These lapses in short-term memory are not just occasional or age-related forgetfulness, but are consistent and increasingly frequent, signaling potential cognitive decline that warrants medical attention. 2. Difficulty with complex tasks. Difficulty with complex tasks is a common early sign of dementia, where managing activities that require multiple steps or sustained focus becomes challenging. Individuals may struggle with planning events, balancing checkbooks, or following recipes, often feeling overwhelmed or confused by tasks that were once routine. This difficulty stems from impaired executive function, affecting their ability to organize, sequence, and execute plans effectively. They might make frequent errors, overlook important details, or abandon tasks midway. Such challenges are not just occasional lapses, but consistent issues that interfere with daily life, highlighting the need for medical evaluation and support. 3. Changes in mood and personality. Changes in mood and personality are significant early indicators of dementia, often manifesting as unexpected mood swings, depression, or anxiety. These alterations can also include a shift in personality traits, where individuals may become more irritable, apathetic, or suspicious without clear cause. Such changes disrupt their usual temperament and behavior patterns, creating noticeable differences from their baseline demeanor. These emotional and personality shifts are not just occasional but persistent and increasingly pronounced, serving as red flags that suggest underlying cognitive decline and warrant professional medical assessment. 4. Trouble finding the right words. Trouble finding the right words in conversation is a common early symptom of dementia, where individuals may struggle to follow or actively participate in discussions. They often experience difficulty naming objects, frequently pausing to search for the correct terms. This linguistic challenge extends to writing and spelling, where errors become more frequent and noticeable. The person might substitute incorrect words or use vague descriptions instead. These language difficulties are more than occasional lapses, consistently disrupting communication and highlighting underlying cognitive issues that require medical evaluation and intervention. 5. Apathy and withdrawal. Apathy and withdrawal from previously enjoyed activities are common early signs of dementia. Individuals often lose interest in social gatherings, hobbies, or sports they once loved, displaying a marked lack of enthusiasm and motivation. This withdrawal from engagement can indicate cognitive decline and changes in brain function, as the person finds it increasingly difficult to initiate or sustain participation in these activities. The shift is not merely occasional disinterest, but a consistent and pervasive disengagement, signaling a deeper issue that impacts their emotional and social well-being and warrants professional medical assessment. 6. Poor judgment and decision-making. Poor judgment and decision-making are key indicators of dementia, where individuals find it increasingly challenging to make sound choices and exercise good judgment. This can manifest in various ways, such as making poor financial decisions, neglecting personal hygiene, or failing to recognize dangerous situations. People with dementia may also struggle with planning and organizing daily activities, leading to disorganized and inefficient routines. These difficulties are not just occasional lapses, but consistent patterns that significantly impair their ability to manage personal and financial responsibilities, highlighting the need for medical intervention and support. To reduce the risk of dementia, prioritize a healthy lifestyle. Engage in regular physical exercise to boost blood flow to the brain. Maintain a balanced diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats. Stimulate your mind through activities like puzzles, reading, learning new skills, and socializing. Manage chronic conditions such as diabetes, high blood pressure, and high cholesterol. Avoid smoking and limit alcohol intake. Prioritize quality sleep and manage stress effectively through relaxation techniques, and stay socially active by maintaining strong connections with friends, family, and the community. These lifestyle choices can help promote brain health, lower the risk of cognitive decline, and support overall well-being. As we wrap up today's discussion on the silent symptoms of dementia, it's clear that early recognition and understanding of these warning signs are crucial. By being vigilant and proactive, we can empower ourselves and our loved ones to seek timely medical intervention and support. Remember, dementia is more than just memory loss. It's a complex condition that impacts various aspects of a person's life. By staying informed and spreading awareness, we can work towards creating a more supportive and compassionate community for those affected by dementia. Thank you for joining us on this important journey, and until next time, take care.